Linda's been managing her prediabetes diagnosis for 6 months. She's had regular checkups with her physician, and her blood sugar levels have been within acceptable ranges. At her most recent visit, they discussed that Linda's management program has been progressing nicely, and that Linda should maintain her current regimen to prevent escalation to type 2 diabetes. Type 2 diabetes is one of the fastest growing diseases in Canada, with more than 60,000 new cases yearly. It's a disease in which your body cannot make enough insulin, or your body does not properly use the insulin it makes. Insulin is a hormone that helps your body to control the level of sugar in your blood. If your body can't use its insulin properly, glucose or sugar builds up in your blood instead of being used for energy. This excess sugar in your blood causes problems and can lead to serious health complications. We've asked Dr. Diana Sherifali to talk about diabetes. Dr. Sherifali is an associate professor at McMaster University in the School of Nursing. Her research program aims to optimize the management of diabetes and quality of life for older adults and people with diabetes across their lifespan. We talked briefly about type 2 diabetes in one of our earlier videos. Can you give us a recap on what we mean when we say someone has type 2 diabetes?
Right. So type 2 diabetes is essentially a hormonal condition. So in other words, insulin being a hormone isn't produced in enough quantity by the pancreas, or it's not used effectively and efficiently by the body. So there's almost like a hormonal imbalance. The question then is, what do we do about it? And in most cases, by making adjustments to how people eat, what they eat, when they eat, we can shift the rise in glucose or the rise in sugar so that the insulin the body's still able to make can deal with that extra sugar.
One of the terms that people sometimes use is insulin resistance. What do they mean
Right.
exactly by that?
Yeah, so a good way to think about insulin resistance is if you think of insulin as keys that open doors. So your body's making keys, but unfortunately the keys are a little bit flawed or faulty. They're just not going in the door, or they go in but they won't unlock the door. That's insulin resistance. Now, the most powerful way to make your body sensitive or decrease resistance is activity, moving. So the more you move, the more active you are, the more likely those keys are to unlock doors. And the doors that they're unlocking are cells. So your body cells, muscle cells, everything will allow the glucose to go in and be used efficiently. So that glucose isn't sitting around in bloodstreams and causing elevated glucose in lab work or causing potential symptoms and side effects and other complications.
So that's a good segue. What are some of the symptoms of type 2 diabetes?
Right. So again, many people with type 2 diabetes have no distinct overt symptoms, but rather they're sort of benign, kind of in the background lurking. Changes to their eyesight, changes at night when they're driving. Suddenly they've noticed a difference in how how confident they are in driving at night based on their eyes. Sometimes it's going to the bathroom more regularly or more frequently, going to the fridge and getting more water or drinking a lot during the day. Sometimes it might be something as simple as feeling very drowsy after you've had a bigger meal. 1 hour, 2 hours after a meal, you're feeling very sluggish, very tired. These are signs and symptoms that could indicate that there's a problem with the rise of glucose following meals. So unfortunately, there's no clear, true tell sign of type 2 diabetes, but these in totality can certainly show us problems in terms of elevated glucose.
So, in terms of diagnosis, would you say it's a mix? Some people, they're just going to their doctor for some other reason and they have routine blood work and the blood sugar or glucose is high. And then maybe for others, they have, some of these vague symptoms that's why they're going to see the health professional.
Oh, absolutely. We've heard many stories where people are at their eye doctor's office getting their eyes screened for various things. And it's the eye doctor that says, I really think you should get your blood work checked. I'm seeing signs of damage to your eyes, at the back of the eyes, the fundus, based on elevated glucose. Sometimes people go to the eye to their family doctor with infection, a urinary tract infection, or other infections that are not healing, and as a result, they're diagnosed. Sometimes people go for insurance purposes for a general health exam, a driver's exam for truck drivers, and depending on what class of license you're going for, there's a health insurance or some sort of regulatory body that requires a test, and that's often how people are detected and identified.
Once it is diagnosed, how can someone with type 2 diabetes manage their condition?
Right. So I think what's imperative is thinking of the words you just said, their condition. So it's something that they will live with. And the fundamental cornerstone of type 2 diabetes management is something called self management. So, really, if you are living with diabetes, you're empowering yourself through knowledge, skills, education, get the support you need. And what that support means is going to diabetes education classes, seeing healthcare professionals that can give you the tools and skills that you need. That aside, we know that there's many medications available, and we've come a long way in terms of the types of medications we can use for type 2 diabetes management. Some of them can be injected. It's not just insulin anymore that's injected. So if you feel comfortable injecting yourself, there's an array of medications that can help lower glucose levels. Oftentimes, people start with one or two or three medications, different types of medications. But it's really a thoughtful and deliberate discussion with your healthcare provider to find the right balance of medications to manage diabetes, but ultimately fit your lifestyle. So if you work night shift, you may have a different requirement than someone that works a day job sitting at a desk versus an airline pilot. So that's really a discussion with your healthcare provider. And
So
then
that combination of all of the non-pharmacologic healthy lifestyle, diet, exercise, hopefully maybe getting professional advice around behavior change around diet and activity levels, but then some of these evidence-based medications may be required depending on how your control is going.
Right, absolutely. That's correct. And I think one of the biggest things we want to encourage people is if you start with lifestyle, active, increasing your activity level, healthy eating, that should not stop if you go on medication. If anything, continue, forge ahead with that. That'll help the medication actually work more effectively in your body. And there may be a time, and we've certainly seen this clinically, where some people actually come off of their medication based on the healthy lifestyle goals that they've obtained and achieved.
Yeah, I was going to ask you that. In a previous post, we talked about pre-diabetes and how, with certain interventions, you can really prevent the development to type 2 diabetes. It sounds like it's almost the case, like with very well managed type 2 diabetes, you may be able to move your glucose control back to like a pre-diabetes level. Is that fair to say? Or
That's extremely fair to say. And I'm
okay.
glad you asked that question because I'm part of a research team led out of McMaster and the Population Health Research Institute, where our whole focus is diabetes remission. So, in other words, you have been diagnosed with type 2 diabetes. And if it's been a relatively new diagnosis, we put you on a menu of medications that help preserve insulin, help your insulin work a little bit better. In combination with intensive health coaching, lifestyle
Mhm.
modification, and weight loss. And in many instances, we've seen people actually regress to normal, not even pre-diabetes, but normal glucose levels and maintain those glucose levels for a year. So there's lots of opportunities. I think the key thing is finding what works best for the individual.
Are there any additional health conditions that those with type 2 diabetes should be concerned about developing?
Right. So A good way to think about glucose or sugar, extra sugar in your body is it's an aging accelerant. So we know that everyone is always thinking about healthy aging, whether it's, our minds, our bodies, our skin. Um, if you think of diabetes as an aging accelerant, we worry about the vessels all throughout your body. And that starts from the tip of your head to the bottom of your toes. So, a way to think about complications is they can be macro, larger complications, or micro, smaller complications. So, let's start with macro. Big area is the heart, and we want to protect the heart as much as possible. So, type 2 diabetes and cardiovascular disease typically go hand in hand. And so, don't be surprised that if you are diagnosed with type 2 diabetes, your healthcare providers will be concerned about your cholesterol levels, your blood pressure levels, your heart function. So, there may be a series of tests to screen, manage, and you may even be prescribed medications to manage those complications or prevent those complications. In terms of micro, we think about the eyes, the kidneys, the nerve fibers in your feet. Sometimes people notice pins and needles in their feet, changes to their kidney functions, and that may come through blood work. And as we've talked about before, changes in their eyesight. These could all be subtle signs and symptoms that there may be some complication developing from a microvascular perspective. So the key thing here is that having type 2 diabetes presents an opportunity, and that opportunity is to screen, monitor, and detect and do something about those complications. It's not to say that it'll always progress to, worst case scenario, but the key thing now is to screen and just be in close communication with your healthcare provider to understand what needs to be done and when.
Do you have any other advice for our patient, Linda, to continue to manage her prediabetes to prevent type 2 diabetes? She seems to be doing a relatively good job so far.
Yeah, I think Linda's on the right path. The advice I would give to Linda is just to carry on. And I would encourage Linda to reach out and get support as needed. We know that diabetes is not something that she should manage on her own. Although we encourage her to, get education and self manage, she's certainly not alone in this journey. Um, with type 2 diabetes, she will need a team of support, whether it's a registered nurse, certified diabetes educator, a dietitian, access to classes, and a close working relationship with her healthcare provider is going to be crucial. So she's on the journey. She's on the right path. I would just encourage her to keep up the great work.
And it does sound like there's some emerging evidence that is worth being attuned to or staying in touch with your healthcare provider, because there may be a role for medications in the prediabetes stage, or maybe more intensive management. If she does start to develop type 2 diabetes, there might be a role for more intensive management, as per some of the research you're doing, to potentially, move that into remission.
Correct. Yeah. And sometimes the intensive management arises because of other factors that are occurring. She may be diagnosed with some other chronic condition. Maybe there's a change in her life situation. Stress can sometimes cause glucose levels to be elevated. So just because there's an intensification doesn't necessarily mean that she's doing something wrong, but rather it's an opportunity to understand a little bit more about what's happening. It may mean an extra medication or an extra dose of a medication. But at the end of the day, it's about finding the right balance of what works with Linda, because this is a chronic condition. So if she is going to be moving forward and managing this, we need to support her. The opportunity still presents for diabetes remission, but again, that's a conversation with her and our healthcare provider.